Hello, my name is Mrs. Giordano. I'm the simulation coordinator at Fortis College, Orange Park. This video presentation is to present the requirements for a sterile dressing change for NUR 104 skills checkoff and NUR 210 competency. The first thing I'm going to do is make sure that my sterile fields are raised up to waist height. Make sure that I have all the necessary supplies, a dressing change kit, an unopened bottle of sterile saline, several pairs of gloves and a pair of sterile gloves, a pen, and hand sanitizer. And since I have all of that present, I'm going to begin. The first step is to open my sterile packaging. Touch the outer packaging, which is not sterile or clean. So I'll perform hand hygiene, and I will remove my red bag for my trash to be placed into. I touched my patient, so I will hygiene again. My next step is to remove the sterile drape from the packaging, being careful to only touch the outer 1-inch border. Next, I'm going to empty my kit onto my field, being careful to not touch the outer edges of my kit to my sterile field. My next step is to not reach across my sterile field and get my normal saline. It is an unopened bottle. It has an expiration date of August of 2020, and pour some sterile saline into my bin. Next, I will don gloves and remove my soiled dressing from my patient, and inspecting the wound and the dressing for drainage as I do. Being sure to hold the patient's skin as I'm removing the tape so as to not cause any tears in the patient's skin. And I note that the outer dressing is clean and the inner dressing is also clean. So I will dispose of that in my red bag. I will remove my dirty gloves. I will perform hand hygiene. Without touching my bedside table or any surfaces. And making sure that my glove wrapper is not over my sterile field, I will prepare to don my sterile gloves. From now on, everything here is sterile from the basin to the glove wrapper. I'm just making sure that I have everything in place that I should. super small smalls. Glove 1 is in place. Sterile gloves are on. Now I'm just going to organize my supplies. Okay, there, now I can see the edge. Being careful to not allow the sterile gauze to touch the outer edges of the packaging. Opening up my swab sticks to clean my patient, and using a single swab stick at a time, cleaning in a single motion from inner to outer. One solid swipe for each swab. My wound is now clean, and now it is time to place my packing in the wound, squeezing out excess liquid. I'm using my forceps to pack gently, covering the entire bed of the wound. This hand is dirty because it is wet. So using my remaining sterile hand, I will first cover with 4x4s. Then I will cover with an ABD pad. And the last thing to do is secure the dressing, which I will remove my soiled gloves, perform hand hygiene. I will date, time, and initial. My first piece of tape. Put on a clean set of gloves. And tape down the dressing. Making sure to tape